Okay, I'm ready to inject Mr. Mancini. Well, to administer the medication. Before I go into his room, I'll perform a little hand hygiene. And I'll don my gloves, put them on. Alright. I'll take the medication to Mr. Mancini. Hello, Mr. Mancini. How are you doing? Good. Nice to see you're doing well. May I have a look at your wristband? Just want to confirm that you're Mr. Mancini. Alright. Mr. Mancini, do you have any allergies? Codeine. Okay, well, that's good to know. And yes, you are Mr. Mancini. Alright. Well, today I'm here to be giving you a few of your medications. I have your heparin, which is your anticoagulant, and I also have your Haldol, which is your antipsychotic. They're both going to be given around the same injection sites. Let me know if you feel any pain. I'll walk you through a procedure, and if you have any concerns, let me know too. First of all, alright, so the first injection we're going to be giving is our subcutaneous injection. Our subcutaneous injection is normally given at 3 locations, preferably the outermost region of the arm, your abdomen area from the coastal to the iliac crest, and the anterior portion of your thigh. These locations are preferable sites due to the large tissue around there, which can be rotated for sites. So if we were to give a medication multiple times a day, for this case it's only twice a day, but for our intramuscular it's 4 times. So these areas will allow you to rotate injection sites multiple times without it bruising or anything like that. Alright, so first thing we're going to do is subcute. I will choose to do the anterior portion of the quad, and I'm going to landmark that site. Okay, so this is the area I'm going to be choosing. I'll put my hand roughly surrounding the area so I don't choose any other muscle and inject it into any other nerves potentially. Just landmark the area I want to do it. I want to see if there's any lesions, any injuries, any bony prominence, just so I don't want to avoid injecting into there. And prior to injecting and finding the site that I want to inject into, I will clean the site with an alcohol swab. It would be nice if we can clean the area for about 2 minutes, but I'm going to go for about 10 seconds going in a circular motion around the site that I chose. Moving slowly away from the center. Okay. I'm going to let that dry. I'm going to toss away the alcohol pad. In the meantime, letting the area dry. Alright, so we have our right girth, we have the right syringe, we have our medication ready. We have the location set. Mr. Mancini is, I would say, around an average weight-wise within BMI. So due to this fact, I'm going to be injecting the subcutaneous injection at a 45-degree angle, just to make sure I don't go more deeper than that. As well, he doesn't have much weight, or he's not too obese, so I won't be doing a pitching technique. I will just cover the area. Okay, so at a 45-degree angle. At a 45-degree angle around the anterior portion of the quad, making sure the bezel is facing up. I'll go swiftly but quickly and slowly inject the volume. I want to make sure I don't go too quickly because Mr. Mancini will feel pain and discomfort from that. Alright, the same way I went in, I want to remove it. And because this is a heparin injection, I don't want to rub the area afterwards to avoid any bruising and from currents. Okay, once that's done, I will put the needle back in a sheath using one hand and discard it in injection site. Our next step, our next injection we're going to take is our Haldol. It's the IM injection. The difference between IM and subcutaneous, as mentioned earlier, is the depth of the injection. Hence why we have a smaller gauge, which is a thicker needle. Anyways, the direction, the angle that we're going to be administering this medication is at a 90-degree angle. Since we want to go past the subcutaneous layer, go right past all the skin integumentary and go into the muscle. Again, just like subcutaneous, we want to go landmark and feel, palpitate the area to figure out if there's any lesions or any areas that we should be injecting into to prevent further complications. And once we find that area, which I'll walk through right now, through palpation, we're going to landmark the site. Again, right now I'm landmarking in the area of the vastus lateralis, which is one of the sites. Another site is the gluteal and your deltoid as well too. So those are 3 locations where you want to ideally perform intramuscular injections. I'm going to be doing it in vastus lateralis. So we have our site, we have our designated area ready, we have our medication. Just like subcutaneous, I'm going to be going in circular motion and using an alcohol swab, which I already did, and toss it up. I'm letting it air dry right now. One last thing I want to mention is that while doing an intramuscular injection, I want to use a pattern called a Z pattern, and that's to ensure that the medication is administered within the location and reduces chances of it being retracted. What a Z pattern is moving the muscle, the mass of the body in the area towards one side with the hand, or you can use a pinch and make the skin more taut. In that area where the skin is more taut is where you would inject. Hold it there for about 10 seconds and then remove the syringe afterwards. This will allow for dispersion and prevent medications to come out. I'm going to remove the sheath, pulling away from my body. I'm going to use a Z pattern with one hand or 2 fingers, and at a 90-degree angle, I'm going to go swiftly and quickly right into the muscle. Once again, just like the subcutaneous, I want to administer medication nice and slowly to prevent any pain or discomfort. Once it's there, I'm holding it in for about 10 seconds and remove the needle, pushing it out of sight. Okay, put the sheath on using one-hand technique. You want to make sure safety is looked after so you don't hurt yourself. Then dispose. Alright, so now both subcutaneous and IM injections have been administered. Our last step to do is to take off your gloves, leave the patient's room, hand hygiene always, and to document. What we want to document is where we injected, how much we injected, if there was any complications, if we had any blood, if we broke a blood vessel, just document what happened.